Well, hey there, caregivers. Today, I want to break down the stages myth and why stages do not tell the whole story. I know this might be hard for some of you to hear, but just hang in there with me until the end. One of the hardest things about dementia isn't just the diagnosis, it's the uncertainty that comes with the diagnosis. I've heard many caregivers ask, what happens next? How does this progress? What should I expect? And what stage is my loved one actually in? And for years, I think that the common answer has always been, well, dementia happens in stages one, two, or three, or beginning, middle, late, or beginning, middle, and terminal. But today, I'm going to share with you what I tell my patients and their families. Dementia is not a straight line. It's not a staircase where you move neatly from one stage to the next. It's more like a river that's constantly moving. Sometimes it's calm and sometimes it's turbulent, but it's never exactly the same river from moment to moment or from one moment to the next. One day, your loved one might be engaging, remembering details, having a great conversation. The next, they might be struggling with the simplest of tasks. And just like a river, dementia doesn't flow the same way for every person. So, today, instead of focusing on these rigid stages, I want to talk about how dementia really progresses and how you can navigate these ever changing waters with ease and more confidence. Those early currents, like when something feels off, dementia doesn't start overnight. It sort of builds up, little small changes, like changes in a current. Maybe you've noticed that your loved one is forgetting names or struggling with things that used to come easily, forgetting those familiar words or losing track of conversations, struggling with planning or decision making, personality changes such as irritability, withdrawal, and anxiety. And this might be the time where you need to start planning. You need to start discussing those medical wishes, those financial choices, and daily routines before things become more difficult. What matters here is framing. Instead of saying to your person, you keep forgetting things, and I've noticed that you're getting frustrated remembering names, maybe try saying something like, let's figure out a way to make things easier together. Think of this as the gentle waves, the small shifts that signal deeper changes beneath the surface. The more you prepare now, the smoother your journey is going to be ahead. So, just like a river, the next part would be the unpredictable waters when things change day to day. And this is where the stages model starts to fall apart. Your loved one seems present and aware, and the next day they're lost, confused, or struggling to recognize familiar faces. And just like a river, dementia can change course in an instant. Common challenges include memory gaps that come and go. Some days they remember everything, and then other days nothing. I mean, have you ever taken your loved one to the doctor and you have a private conversation with the nurse or the physician and you let them know, my loved one seems really off, or things are really bad at home? And then when your person gets on the exam table and the doctor goes into the room, your person pulls off as knowing everything. They know the date, they know the time, they know the year, they know the president, and you're just sitting there flabbergasted. Well, this happens all the time. Trust me, I have seen it a million times. You might even notice that your person has increased confusion, wandering, increased agitation, or bigger emotional shifts, going from 0 to 1,000. You're going to notice increased difficulty in managing those daily activities, cooking, cleaning, medications, and finances. And during this time, I want you to think about meeting your person where they are, not where you think they should be. Instead of correcting them when they forget something, go with their flow. If they think that they need to go to work or that they need to go home, Instead of saying, you're retired, or you live here now, or you live in this building now, or this assisted living, or this is your home now, say to them, well, what did you love about your job the most? Or what did you love about your home the most? Tell me a story about your home. Tell me a story about your job. And this is going to pull them from wanting to go home or wanting to ask repetitive questions. You get them involved with a story or you get them involved in something else that they're familiar with. Safety becomes a huge priority here because your person is at risk for falls, wandering, getting lost, and medication mistakes. And you can expect those ups and downs. Some days will feel like progress, while others feel like huge setbacks. And neither of those define your whole journey. Instead of thinking, what stage is my person in? Ask yourself, what do they need from me today? I like to think about the next part of the journey as the deep waters. And this is where care needs change completely. Because as the dementia progresses, caregivers say, I feel a loss. I feel heavy. I feel my loved one is slipping further away. And it's true because they are. Here's something important that I need you to remember. Even when words are gone, connection remains. Your person may not remember your name, they may not remember your relationship, but they are going to still recognize emotions, love, and comfort. So while it's important to remember that there will be difficulty communicating, remembering that words fade, but emotions don't. So patience is going to be important here because as your person's needs change, there's going to be an increased need for hands on care from you or from someone else. You may need to provide full support for your person at this time, whether that's feeding them, dressing them, and probably even mobility support at this part of the journey. You're going to notice physical changes, difficulty swallowing, weight loss, increased sleeping hours. And all of those things are things that you need to be reporting to your PCP. During this time, nonverbal communication becomes very important. A smile, a familiar song, and the warmth of your touch, these can spark deep emotional connections with your person. Your role starts to shift from that of caregiver to comfort giver. And while this can be emotionally heavy, grieving as a caregiver is completely normal. Give yourself permission to feel those emotions. Even when your person's mind forgets, their heart's going to remember. So I know that my philosophy is a little bit different because dementia isn't a straight path. It's not like a staircase. We need to remember that no matter where our loved one is in their journey, the one thing that remains constant, they're still here. They're still your person. And your love, your presence, and your care mean more than any words can express. So instead of worrying about what stage they're in, focus on where they are today. How can you meet them in this moment? And how can you make today just a little bit easier, a little bit more peaceful, and a little bit more filled with love than yesterday? And if you'd like to keep this conversation going, or you feel like you might need a lifeboat because you're drowning, I would encourage you to join my group, Dementia Caregivers Success and Support Network, because here you can connect with other caregivers who understand the journey. You can also get expert advice and support. You are doing an incredible job. Keep learning, keep loving, and most importantly, give yourself some grace. It's hard, it's tough being a caregiver. As always, I'll be here caring for you as you care for them. Take care, and I'll see you next week.